Hey guys, Real Dr. Jin here, board certified internal medicine doctor. For those who open this channel for the first time, I want to give you a little bit background of this YouTube channel. This YouTube channel reviews medical dramas with you. Now we are on Grey's Anatomy. For those who are a big fan for Grey's Anatomy, definitely you need subscribe to this channel. Because this is the only channel that reviews Grey's Anatomy one by one with you. Now we are on episode 7. Some of the audience say this brought them a lot of laughter, and other audience say at the same time they learned a lot of the medical knowledge. And I'm so glad a lot of new audience join us and enjoy watching Grey's Anatomy together. With more audience join us, we will have more fun. And today we are going to review Season 1, Episode 7.
So whatever else you got, bring it on.
A lot of pus on the face. What happened? What happened to this patient? Let's take a look.
She got some bug on her trip to Mexico with her friends. I told her not to go to a third world country, but does she ever listen?
She's been weak ever since, and she's lost weight.
Barely.
And this morning she passed out in the shower.
So this patient lost a lot of weight and passed out in the shower. What happened? Usually when patient passed out, we called it syncope. We have a lot of reasons for syncope clinically. And the most common reason is from the heart or from the brain. Cardiogenic syncope or neurogenic syncope. Patient looks very young. What happened?
When was the trip?
A couple weeks ago. I'm really fine. I just have a fever. Okay, well, will you lie back for an exam for me? No, please. I don't need an exam.
This scenario is not rare in clinic. Whenever patient refuses for the physical exam, we have the gut feeling. Sometimes patients hiding something.
Just give me some antibiotics and send me home.
Patient asking for antibiotics. That is very common in the clinic. I am working in urgent care. We have a lot of patients came with a sore throat and they asking for antibiotic. Some patient came for the sinus infection, they asking for antibiotic. Some people came for the coughing and they ask for antibiotic. But antibiotics cannot heal everything. Sometimes it's kind of virus infection, the antibiotics do nothing. And sometimes the antibiotics may give you some side effect, like rash, like GI upset, like nausea, vomiting. That's why doctors limited the antibiotics use only when it is necessary.
Do the exam.
No. This is crazy. I'm fine.
For God's sake, Claire, I don't want to spend my entire day here.
You know, actually, Mrs. Rice, this might be easier if we had some privacy. So, would you two mind leaving the room?
That's fine.
Oh, Dr. Gray is so smart. In my clinic, we do see some minors, and sometimes they don't want their parents to know some situation. If we have that kind of feeling during the interview, we will ask the parents to leave the room and we have a discussion one-to-one. This kind of situation is very common when it comes to the STD screening. Sometimes we need to know if the patient is sexually active. Sometimes the parents definitely say no. However, when we talk to the patient who is the minor, she may say yes. That's why when we talk to the minors, we need to ask the parents to leave the room. Because only the truth will help the doctor to make an accurate diagnosis. Dr. Gray now is doing the physical exam.
Don't push so hard. Can you lift your
This is not accurate clinically. If we need to fully examine the patient, it's a better idea to let patient gun himself or herself. Scars.
There. You've had surgery recently. These scars are still pink. Don't tell my parents. You did this in Mexico so your parents wouldn't know?
It seems the patient went to Mexico to do a surgery on the stomach, and she lost a lot of weight. What do you think?
Before you guys start, I know you're mad.
Disbelief, Claire. Just disbelief.
Where did you get the idea to do this?
The internet.
Hey, you don't need to lose weight.
What are you waiting? And how much have you been working out? I mean, most of the time when people hit their target weight, they have to work to stay there.
Everyone gains weight in college, Mom. There's not enough time for exercise.
So, seems this patient made a shortcut to do a bariatric surgery in Mexico. Why she needs to go to Mexico for the surgery? We have a lot of bariatric surgery in the US. Let's take a look at indication for surgery first. Then you may find the answer. We have two criteria for the bariatric surgery. One is BMI higher than 40. Two is BMI higher than 35, but patient has comorbidities related to the obese. Obviously, this patient does not meet either of the criteria. I believe that's why patient went to Mexico to do the bariatric surgery out of pocket. I agree with that. She looks good. She does not need to lose any weight. But if she do want to maintain the good weight, exercise and diet control is the best way. And sometimes the obese running in the family. But look at the figure of the dad and the mom. The chance for her to be obese is much less than somebody else. This reminds me of a joke. Patient, doctor, obesity runs in my family. And the doctor say, no one runs in your family.
I just thought if I wasn't worried about my diet, then I could focus more on my studies.
Oh.
So you took yet another shortcut.
I think we should focus on taking care of your daughter. And Claire, your parents agree. The best thing to do is to reverse the bypass.
When they mention the bypass, the full name for this bypass is loss丨gastric bypass. Let's take a look at this picture for better understanding. Before surgery, the food goes from the esophagus to the stomach, and then goes to the duodenum, and then small bowel. The surgery will cut the stomach into two parts, one small part and one big part. And they keep the small part as your real stomach later. Every food goes here and you will feel very full and you will stop eating. Ooh. And this big one can continue secrete the enzymes to digest the food. And this goes this way to the small bowel. As you can see here, it's a complicated surgery. And this kind of surgery was used as a treatment for the gastric cancer before. It's a complicated surgery.
No, it's my body. I do not want surgery again. There are serious complications, and this is about your health.
Right, this complicated surgery will bring some complications. If it's not done by a very experienced surgeon, you will get more complications. This patient developed a fever after this surgery. Very likely, patient have some infection in the stomach.
I'd rather be thin.
Well, I'm afraid the choice isn't up to you.
So when the mom mentioned this choice is not up to you because this patient is not adult yet, less than 18 years old, we call it a minor. We do have some special scenario that the minor can make decisions. What situation? If the minor is economic independent, if the minor is married, if the minor attended military, or if the minor came here for the STD treatment. In these scenarios, we don't need to report the situation to the parents.
Handle with care. This thing's full of gunk, I know. I need to free them.
As mentioned before, this patient went to Mexico to have this bariatric surgery, and it seems this surgery resulted in a very serious infection in the stomach and giving this huge abscess.
I may not do it your way, but it gets done. So whatever else you got, bring it on.
Poor Dr. Gray, full of pus on the face. That's why it's very important to wear the goggles all the time. The goggles is very helpful not only for the pus, most of the time it's the blood. And sometimes we don't know if the patient has hepatitis B, HIV, hepatitis C. All this virus can be transmitted from the blood. So if we're wearing the goggle, it can give us a very good protection.
Okay, Dr. Gray, now that you've drained the organ, we can attempt to repair it.
Now my day is
Perfect.
Ew, it smells.
That would be me, or more specifically, my patient's insides all over me.
It's not very often with the pus all over, but sometimes we have patients vomiters all over. So it's a better idea to prepare a backup scrub in the hospital.
We were able to reverse the gastric bypass, but we did lose a significant portion of her bowel, and because of the short gut syndrome.
Short gut syndrome. Let Care help you to explain. So basically we have gut here. Because this infection and abscess, they remove part of the gut away. So this patient only have another part of gut left in the stomach. Typically we have 2 meters of gut in our stomach, and we do need that for the digestion. If part of the gut is removed, sometimes we are not able to fully digest the food. In that case, we may lack of some nutrition, vitamins, and some minerals.
You have no idea what's going on in that girl's mind. You're her mother. She worships the ground you walk on. She didn't do this for herself.
She's completely ridiculous.
Shut up.
Did you fix me? No, not completely. So, I won't get fat. No. Oh, that's awesome.
The patient is satisfied with the side effect of the surgery. With this shotgun syndrome, this patient may need take a lot of supplement all her life.
But life isn't supposed to be like this. It's not supposed to be this hard.
Okay, this is the end of episode 7. Let me go through the whole story with you. Claire, which is a minor, went to Mexico to have a bariatric surgery because she's afraid of getting fat. And this surgery resulted in very complicated complications and developed a lot of pus, as you can see. Dr. Bailey and Dr. Gray performed a surgery to remove all the pus, but cannot save all the gut. So they resect part of the gut. This gives the patient another complication we call shotgun syndrome. With this shotgun syndrome, this patient need take supplements all her life. Bariatric surgery is not the first choice for most of us. If you're worried about your weight or if you want to be healthy, you can check jincare.org. I put a lot of recommendations there to help you. Hopefully, this advice will help you to live a better life. If you like my review and want to stay with me to review more Grey's Anatomy episodes, please subscribe, turn on the bell, and you will not miss any of these episodes. Be happy and stay safe. Be happy and stay safe.